just shook her hand. And well, Margie is a PTA. And if you don't follow her on social media, I highly encourage you to find her on social media, and they'll put that in the chat box. But it's at Not Just a PTA. And Margie will be telling us about her journey, her role in advocacy, and her role in the profession, and also telling us a little bit about what PTAs do. So without further ado, I want to bring Margie up to the screen. If you can unmute and just tell us about yourself and tell us your why, Margie.
Hi everyone. Thanks, Gustavo. Thank you for having me. I'm Margie. I'm from the DC area, residing in Northern Virginia. I graduated from Northern Virginia Communities College PTA program in 2018. Um, my why, that's a fully loaded question, Gustavo. I really enjoy meeting people. I think my page kind of took off during the pandemic. We'll get into that later, but I had nothing but time on my hand because I was furloughed. And it just built from there. I love connecting with people and meeting people like you guys. I'm just really honored to be here.
No, Margie, thank you. Thank you for coming on and speaking with us. And I just want to encourage all participants, please feel free to ask questions and so forth to Margie, either in the chat or raise your hand in the comment box, and we'll have those questions answered by Margie. Or if you want to comment, and please feel free to turn on your webcam. That always helps gauge the crowd. Don't feel like you have to, though, but please feel, if you can, we'd love to see those beautiful faces. So Margie, we met, we've been kind of chatting back and forth for a bit through different things, and got to meet you at the centennial events at APTA, which was so awesome. We actually had some seafood there in DC, which was really good. But something that seeing you and talking with you, definitely seen a lot of that passion you have for the profession. So I wanted to ask you, could you explain to us your route in becoming a PTA?
Sure. So I would say I was probably an untraditional student. I had my bachelor's degree previously. I'm a Old Dominion University alum, and I got my bachelor's degree in exercise science. And I swore school off. Right? I'm never going back to school. I don't care. I did the bare minimum. I mean, if you follow me, I'm very blunt. I'll share my GPA and everything. I wasn't a great student, and I think it's because I didn't know how to study. I didn't learn, so I did what I did to the bare minimum to graduate. Worked on and off for 3 years, everything from a PT tech aide, a chiropractic assistant, exercise specialist, corporate wellness, and it was back to back layoffs, and I think I hit rock bottom. And my colleagues at the PT clinic I was a tech at was like, Margie, why don't you just go back to school? And I was like, I am not going back for my doctorate. It's way too much. It's way too much time. And my GPA, my grades, they would laugh at me at admissions if I submitted an application. So they told me about the PTA program, and a couple of the techs at that office were in the PTA program at Northern Virginia Community College. They said, why don't you check it out? I'm like, okay, I will. Went to orientation, went to the, I guess, an interest meeting. I fell in love with it. I did really like physical therapy, but I just felt like I wasn't, I don't know, maybe smart enough to get into DPT school. So I chose the PTA route, hardest but best decision I ever did. I really think Nova is the best PTA program out there. I really hope there are some Nova alums or students out here. Um, it was harder than my it was harder than my bachelor's degree, which took me 5 years to get. So you guys can gauge that how you want. Um, and I felt like I finally had a purpose. We had 8 a.m. classes and I didn't care. I enjoyed coming to class early. I enjoyed learning. I finally understood. Things made sense. I knew how to study. I had a great group of study buddies, and it just felt right. Graduating and taking my board exam to getting my first PTA job, everything kind of fell in line. And I really love what I do, and I'm a huge advocate now for PTAs, student PTAs, community colleges, and everything in between. I think sometimes there's a misunderstanding. I see a couple of familiar names on here, but if you follow me on social media, I posted like PTA school is not easy just because it's at a community college or it's 2 years. It was the hardest and best thing I've ever done. I don't know how many times I just, didn't think I was going to make it. I think there may be like sometimes an overlooked or underlooked mentality when it comes to the PTA program. So I want to make sure people out there know, like, you know, it's not what the degree is. It's not how much schooling you had. It's like it comes down to patient care and how you treat the patient, your bedside manner. And honestly, none of my patients have ever been like, oh, you're an assistant, oh, you're a PTA, and they don't want to see me. They don't really even know the difference between PTA and a PT. So yeah, that's my short end of why I love my profession.
Thank you for that, Margie. So a lot of us on this call are PT students, PTA students, some APTA members, some of us not. And I want to ask you a question. You started talking about some of those things that some people don't get, right? Like PTA school, just because it's a community college doesn't mean it's hard, right? With those misconceptions. And how patients even view PTAs versus PTs, they don't always see that difference. So I just want to ask you, Margie, what are some misconceptions about PTAs that you would like to change on top of the ones you've mentioned earlier?
I'm not a glorified tech or an aide, so I wish people would stop saying that. Yes, I see. I'm sorry. Ugh, the Zoom box is so small. I just saw somebody do the ooh, ooh. Nicole, I think. Um, I'm not waiting to finish my career. I am not. Um, I'm not the PT's assistant. Like I'll just use you, Gustavo. Like, I think we need to be mindful in our career how we address PTAs. We're PTAs. We're the physical therapist assistant. We are not. I'm not Gustavo's assistant. Like I'm not. So just to be mindful how you address PTAs. I know there's been a lot of talk about changing the name PTAs because PAs, physician assistant, recently changed their names to associates. To me, I don't really care what the A stands for. I don't care where you put the A, really. Um, it doesn't matter because how good of a clinician you are really depends on the patient and how they see you and how you treat them. Um, I don't like it when people just kind of assume. I rather you ask than assume. Be like, like, what is a PTA and how are we different from a tech and an aide? I'm like, well, I took a board exam. like, um, I spent much more money in tuition and a tech and an aide didn't. I think just asking and starting those conversations, just like, you asked about somebody's pronouns, it's the same thing. You don't assume. And I think we as PTAs need to do more educating and more advocating, self advocating for the profession in our field if we want that respect. But it's mutual. So I don't really care for the title. I mean, you can call me an assistant, you can call me a therapist. Really, they just call me Margie. So it doesn't matter to me. It's just I care how my patients like their outcomes, how they perform, and how fast they can get back to the things they like to do. So I just wish maybe a little bit more support from our fellow PTs to just maybe introduce PTAs, like maybe like a forward team. Like this is, I'm the PT, Gustavo, this is Margie, the PTA. We are going to be treating you. So sometimes you'll see Margie, sometimes you'll see me, but like that team approach, it can be very helpful because it is a little awkward when they see the evaluating PT and then they just see me and they don't know what's going on.
No, Margie, I appreciate that. And thank you for sharing that. And that kind of leads me up to my follow-up question with you. Um, you're talking about that teamwork, right? And not having the misconception. I loved how you put it. You're not Gustavo's assistant. That's not how to see things. And how to strategize, how to do better care. So my next question to you is, what are best strategies for PT and PTAs to work together? Because in school, I never really got to work with PTAs, other than sometimes in clinical and like very few times. So, what are some strategies coming from you, Margie, that you've seen that you liked or didn't like?
I think it starts from school. Like I said, I went to Northern Virginia Community College. The closest DPT program is Marymount. Shout out to any Marymount students here. Um, what they did in my second slash last year and the DPT's first year was they spent a day. The DPT students came over to our campus and we were given case reports and how we would approach it as a PT PTA team. I think it was very strategic why they chose second year PTA students and first year DPT students because we're on our way out, about to graduate, take the board exam. It shows how much we know. Granted, I didn't take, 3 years of school. However, if I'm your assistant, I'm your right hand woman. I need to know just as much as you. I can't evaluate, I can't diagnose, but I'm gonna know how to get somebody back, following protocols for an ACL repair. I'm gonna know what not to do, after a cabbage with sternal precautions. I just think that there's a misconception or a misunderstanding because of the huge gap in the degrees, that maybe we don't know as much, and that's not true. I wish more programs did that. I would encourage PTA and DPT programs to reach out to your local, if you're a PTA program, reach out to your local DPT program and vice versa and see. It was just a day and it wasn't even a whole day, maybe 2 hours. And it was just really nice. And I went to a networking event for VPTA last week and the Marymount students told me that they still do that till this day. And it's very helpful. But just like any other relationship, communication's key. Um, I like to look at my PTs as colleagues. There's no greater than, less than, even if they're a director position. I think there needs to be respect and there needs to be open communication. Um, and just preference of how you want to go about things. Like think about back when you were a student and how you develop that relationship with your CI. Just keep in mind, how we can approach this problem or this patient for the best outcome.
Thank you for that insight, Margie. And thank you also for you participants and viewers who are just really filling up the chat box here. Something I wanted to ask from everyone viewing, please type in and also on replay, are you a PT, PTA? Are you a student PT, a student PTA? Type that in the chat box and let's see where individuals are coming from. So my next question to you before we go into announcements, Margie, you spoke about the degree gap, right?
Mhm.
And how that can be seen. So could you give us, Margie, an overview of what schooling looks like? I know you touched a little bit on it before, but what that schooling looks like to become a PTA from your experience and your colleagues.
Sure. The PTA program is usually a 2-year associate's degree at a community college or some type of trade school or allied health school. We do have 3 clinical rotations. It varies from program to program. I've heard different time frames when it comes to weeks for clinical rotations, and we have all the courses just like a PT program, neuro, which I hated, um, cardiopulm, we had physiology. Anatomy was a prerequisite, so you couldn't even have a seat in the PTA program. Specifically for Nova's program, there was only 40 seats every year. And it's competitive. I believe when I applied in 2015, 2016, it was for every 1 seat, there were 3 applicants. My class started out as 40, and we had 3 people waitlisted. And it's not easy to get in, and it's not easy to get through. We were a class of 40, and we did not graduate a class of 40. So that's another thing. Like, I wish people wouldn't think it's so easy because at a community college, because if it's so easy, then everybody could do it. But clearly, I mean, I'm pretty sure everyone here can relate. You know somebody that didn't pass the course with you or pass the board exam with you. Um, we have didactic work, a lot of lectures, lab simulations, practicals. Everything you're doing, we're doing too. I think the only thing we don't have is like that diagnosis course. We're that's not in our job description. That's not our scope of work. So that would make sense. However, we do have pathology, so I need to know, what these diagnosis looks like or what they present. Um, Anything from ortho, which is I'm really strong in, down to GI and neuro and pelvic floor, which we kind of breeze by because as a new grad you're supposed to have general knowledge. We're not supposed to be a specialist in any field or topic, and that's where CEUs come in. And so I just want to reiterate, like, I have to know just as much as you to be a PTA, or else you wouldn't trust me with your patient. Especially when it comes, like, I work in home health. I don't have a supervising PT next to me. I can't turn and ask my colleague, and it's me and the patient and maybe a caregiver. So that's a lot of trust that you have to give me as the evaluating PT to know my ish. So um, I just want to just bring that up time and time again. Like, I just look at the degree. Don't look at the degrees, and look at the person and see um, how you can work together. And also, that puts a lot of pressure as new grads, whether PT or PTAs. You're not supposed to know everything. Like, it's okay. It's okay to say I don't know. I'm 3 years out and I still say I don't know. And you ask for help. So I sorry I got off on a tangent, but back to it. We have to have our course load is just as heavy and rigorous. It's only 5 semesters, compared to 3.5 years for PT school, not including prereqs. So it's very hard. It is not easy. There are many sleepless nights and crying nights. So I think we can all share that. PT is not an easy field.
Thank you for that, Margie, and I agree. There were some nights, some exams, and then after exams, I was like, yeah, I don't know if I'm gonna be here tomorrow. So thank you for that info, Margie, and I just want to remind everybody that's on the Zoom call with us. Thank you again for coming. Please feel free to type any questions or add comments. Unmute if you like, raise your hand and unmute, and we'll get to you. Margie definitely wants to hear from you guys, and not just from Gustavo. My voice gets annoying sometimes. I know, Margie. But before we go into our next set, we're going to have a few announcements for everybody. And for that, I'm going to invite Patrick Swayze. He's serves on the APTA Student Assembly Board of Directors as a nominating committee member.
What's up, guys? So here, Patrick Swayze. So a couple announcements. I'll make it real quick so we get back to hearing more good stuff from Margie. So the 2021-2022 Student Assembly Board of Directors elections is coming up. So follow APTA student members, just our social media accounts to be informed of the candidates. So watch the IG videos, be engaged on the APTA student election web page to stay updated. Ballot opens October 7th. And so for those that cast a ballot, you'll be able to, your name will be put in for a raffle for our score builders, board prep book, and 2 base camp annual. So also for the board prep. So get on that. So again, the elections ballot opens October 7th. And then next announcement, APTA is offering to all active APTA student members a chance to volunteer at APTA CSM February 2nd through the 5th in San Antonio. So the volunteer application portal is open and will close on Friday, October 8th. So, or until all the volunteer spots are filled up. So as soon as possible, if you're going to CSM and you want to volunteer, get on that. They will provide, in exchange for being a volunteer, you will be reimbursed $210 of your registration on the last day of the conference. So it's a great opportunity to volunteer, meet some new people, as well as get reimbursed for registration. So that's all the announcements that I have now. Let's get back to hearing more from Margie.
Thank you, Patrick. So Margie, we've been talking about schooling your route to being a PTA and getting into the program and graduating, but you're much more than that, right, Margie? And in our conversations, something that was brought up, I remember asking you, when we were in Virginia or DC, I think they're kind of the same, was about your page. Yeah, why did you start that social media account?
I think all of us maybe Googled or Facebooked or we searched PT or physical therapist students or physical therapist assistant students when we were in the program. At least I did. And I found that a lot of pages catered to PTs and DPTs and nursing as a whole. You know, there's a huge nursing community on social media. I didn't really see that much for PTAs. And I was like, maybe one day I'll start a page. I don't know. What would I even talk about? So I graduated in 2018. And then maybe a year after 2019, I started my page. You can scroll all the way to the bottom of my page. I don't really delete anything. You can see when I first started, I had like 10 likes. And I think they were all from my friends who knew nothing about PT. They were just supportive and sorority sisters and stuff like that. And so I took a hiatus between, I want to say like end of 2019 to spring 2020. So COVID hit. COVID hit March. I was working outpatient ortho and I got furloughed. Low-key didn't know what furloughed meant. I had to Google that. I'm like, okay, so am I unemployed or I'm not unemployed? And how does unemployment work? And it was a new thing I had to navigate. And so I had a lot of free time, like a lot of free time. So I was on my social media. I learned American Sign Language and I picked up calligraphy again and just things to keep me busy. And I ran into a PTA. I believe she's in Georgia, but she graduated from Virginia. She did pet therapy, specifically canine therapy. And I'm going to shoot myself in the foot later because I can't remember her name. But I was like, hey, I've never heard of that. Do you mind, like, if we get on a Zoom call and can we just chat? And then she's like, yeah, sure. Super sweet, nice girl. And right before, I want to say maybe like a few days before, I asked her, I'm like, can I record our interview just for, research purposes? And she's like, yeah, of course. So something that would probably take, I don't know, 10, 15 minutes took an hour. And I had this data now and I had this footage. I'm like, what am I going to do? I'll just post it. I'll post about it. And then a few weeks later, a traveling PTA, which is rare, came across my page and I asked if I could interview her. And then I interviewed a few of my classmates, and it just kept going. I took a social media master class from physiotherapy with Andrew. It was free, and I'm like, okay, I mean, never thought about being an influencer, but sure, why not? If I don't have to sell tummy tea and waist trainers, sure, why not? Taught me a lot about like algorithms and hashtags and things to do and things not to do. And my goal wasn't to like have 1 million followers, and my goal was to reach out to PTAs and student PTAs, because I didn't have that resource when I was a student or a new grad, and it would have been helpful if I could just send a text or a message and be like, hey, I don't know this, because we've all been there wanting to ask a question that feels like a stupid question. And on my page there's a rule: there's no such thing as a stupid question, because you clearly can't ask your CI or your professors, you can't ask your classmates because they're in the same boat. Who are you going to ask? So that's why I started my page. And I don't remember what happened. I think one of the bigger PT pages shared a post of mine, and it just blew up. I went from like 20 followers to 200 in a month to 500 in 3 months, and right now I think this past week I hit 2,000, and I was like, I don't even know 2,000 PTAs. Like, and not all my followers are PTAs or student PTAs. There's PTs, there's athletic trainers and chiros and an eye doctor and nurses, anything in the health field. And I am strategic about who I follow. Oh, by the way, I do follow back. If you don't have like PT or PTA or SPTA on your bio, I probably won't follow you. Just send me a message. It's nothing personal, but I'm strategic about who I follow. Like, I don't even follow my boyfriend on my PTA page because you're gonna mess up my algorithm. So, because he doesn't do anything in healthcare, and even like friends who support me, I'm like, it's nothing personal. It's just this is how social media works. And every week on Thursday, I call it Therapy Talk Thursday. I interview somebody, usually a PTA or a student PTA, and I give them the mic. Tell me your story. Tell me what you're doing. Tell me, are you in a specialty? Are you a student? How are you navigating COVID? It ranges from 30 to 60 to 80 minutes, depending on how much I talk. But I get to meet so many cool people across the United States, and outside the US too. And it's just really nice that even though we've never met, we don't know each other, we have that one bond, and that's PT. And I try to post frequently. Right now, I'm trying to focus on PT in Spanish because it's Hispanic Heritage Month. I try to tie in what's going on to PT as well. I'm a big advocate for PTs of colors, women PTs, PTAs, minority pages, because that's who I want to highlight. Because when I turned on social media and followed those PTs, majority of them were white or Caucasian. Nobody looked like me. Nobody was, a person of color or a woman of color. And that's discouraging, because if you looked at my graduating class, half of us was, from a different background, we weren't white. So, and I think that creates a certain level of understanding. There's different struggles. I'm sure, Gustavo, you go through troubles that I may not ever understand. And it was hard to kind of connect to those pages I'm not the page that I'm going to post all these exercises. There's so many pages for that. I put it in my bio, I just want to connect and network with PTAs and student PTAs. That's it. If I had a business card for not just a PTA, that's it. And I post reels when I can. I love making people laugh, even if it's on my expense, it's fine. And I'm pretty outspoken. I'm very surprised how many times APTA reach out to me because I don't have a filter. If you follow me long enough, you will see me cuss. You will because and I don't edit, so that's why I like IG lives. I can't get into YouTube because I don't do audio visual. I'm the last person you want to talk to tech to. I don't polish or edit anything. You will see me stumble. You will see me brain freeze live on Instagram, and that might be a fear, but I'm just tired of seeing this polished world that we live in and this edited and the filters, and I'm not. You're gonna, don't ask me about cranial nerves on IG Live. I don't know them. I took the board 3 years ago. I don't know them. That doesn't mean I'm a bad PTA. I just don't have a lot of neuro patients. And I kind of bribe my colleagues, look, I will take, a COVID patient if you just take this stroke patient because I don't know what to do with them. Neuro's not my best field, if you can tell. So I try, if you follow my page and follow my stories, I try to show you a day in the life of a home health PTA because my class didn't get to rotate in home health settings. I'm very jealous at my colleagues, my other PTAs around the world who got that opportunity. I got stuck with acute care. And if you follow my page, I'm not a fan of acute care. It was really hard. I cried every day my first week. I share you my experiences. I show you my score builders and what's the other thing? Um, the PED exam scores. I'm very transparent. I tell you how much I make. Um, I tell you what setting I work in and how much I made then. I talk about burnout a lot. I advocate for our profession because I think it's important. Um, and sometimes I call out the APTA. That's why I'm very surprised. The sometimes I get certain invites. I'm like, but I just bashed you 2 weeks ago. But I think we need that accountability, right? How can we fix? How can we as an organization fix something if they don't know about it? And it may be very innocent, but somebody needs to be the whistleblower. Maybe that's me. I've always been very outspoken. Um, but this is how change happens. you know we don't have a vote, now we do. Like, yeah. And there's just a lot of other issues too, like what PTAs can and can't do. There's a lot of gray. Do I follow state practice? Do I follow APTA? Do I follow what is it, CAPTI or the Federation Board? There's just so many questions. It's overwhelming. I just wanted to be that resource. So instead of asking why are there no PTA social medias, I just changed it and I said, why not me? And it's been a wild journey. I didn't expect my page to blow this big. Every time there's an influx of followers, I think I got hacked. And so it's really nice to see. I think I kind of like being that mentor person a little bit more than I like patient care, and I love patient care. I love what I do. There's a reason why PTAs are the number one allied health profession according to US Business. Um, and I think maybe it's time for a little bit more representation. It is 2021.
Oh, thank you for that, Margie, and thank you for that transparency. I know here in the comments too, there's a lot of thank yous in that aspect. So thank you for that, and for being open with us about the why you made that page and so forth. Definitely appreciate that. So I want to ask you, this was your way of advocating for the profession, for PTAs. What would you recommend for other PTAs and PTs, but maybe more geared to PTAs, to continue advocating for the profession? What other strategies?
I really like what APTA is doing. I think Lisa and Amelia, we had a pre-planning meeting before this event tonight a few days ago, and they said something that really touched me. Like, I pointed out, like, there's always there's since last year, maybe the year before, there's this big move for diversity and inclusion, right? Well, how can you have a diversity and inclusion board when nobody's diverse on your board? There's not a person of color, there's not a woman, there's not a person in the LGBTQ community, there's not somebody that works or lives in lesser social economical side of town. And, I think it's important. Um, with that being said, I feel like we, as, clinicians, members, have to step up too. I think it's intimidating, trust me. I get hit up by APTA and the PTA caucus a lot, like, hey, do you run for a position? No, because I like this. I like unfiltered, laid back. I can say whatever the heck I want. I'm not very good. This is why I don't work in an office. My boyfriend works for the government. I could never. I would get fired the first day. I am not very good at customer service. I'm a little bit of firecracker and I kind of speak my mind, and it's not somebody you want to be in, I don't know, an executive position. However, I do love meeting people. I am good at that. I know my strengths and weaknesses. I get very intimidated when legislation comes out and it's section 3, article B dash what does that even mean? Just, I appreciate APTA's email that the legislation is the topic or the title. This is what this piece says. Seriously, Barney style, dumb it down for me, because when you speak, you make it in a language where people don't understand. And you have to understand that this country, not everyone is a native English speaker. You want more participation. You need to, inclusion starts there. Make it make sense. And inclusion also started, I was really over it when the organization, I guess when they hosted events, for example, like conferences or stuff, or they want to invite PTs and PTs of color, everything was PT, PT, PT. Well, you want to be inclusive, why don't you throw a PTA in there? I want to have a trivia night. I want to show you how smart I am too. Maybe, I don't know if anybody from like Centennial is there, but or like the PT Pack trivia, that'd be nice for a PTA trivia night. Um, and I think it also takes people to speak up and say things like that. I think it's important to show the diversity in our field because I don't know about you, but my class is very diverse. So I think it's important to showcase that. I'm always, gonna stick up for the little guy, and that's, people of color. That's gonna be LGBTQ. That's gonna be Black Lives Matter. That's gonna be Asian. That's gonna be Native American. That's what my page is about. I've gotten a couple of messages saying, if you want to be an influencer, you shouldn't be political or you shouldn't post about politics. Medicare is about politics. Why don't we talk about these cuts? I see a lot of head nods. Like, don't, I really, pet peeve of mine, and my PTs know, don't tell me what to do. Now there's a safety concern. Yes, like I am realistic, but I really hate when people tell me what to do, especially on my page. I mean, if you're not going to sponsor me and put some coins in, I don't really care what you have to say. The unfollow button's right there. My page is public. It's not private. You can come and go as you please. And I say that at least once a week. And this is what you get. Gustavo said, just be you. I'm like, are you sure? Because APTA is hosting tonight's event. I don't want to get in trouble. I don't want you to get in trouble. But this is me. This is me on social media. Um, and this is where I'm most comfortable. Please don't make me wear a pantsuit and speak to legislators. Please don't make me write a letter to Congress if it's not pre-written, which I really appreciate APTA doing. I'm not good at that. I'm very good at connecting with people and relating to people and kind of that mentorship, big sister advocacy, because it's really scary as a new grad. You went from student to now practicing on a real person with real injuries, and they can get really hurt if you do something bad. That's scary. I want to be the resources like, hey, Margie, I'm just not really sure. I've had people say they don't know if PT's for them, and that's okay. They want to switch career fields or settings. I just wanted to be somebody, if there was anybody you needed to ask a question of too, there's no such thing as a stupid question on my page. And that was it. That was it. I don't even remember what your question was, but yes.
No, thank you for that, Margie. And something, I love what you talked about, knowing your strengths, and that connection. And I can tell you guys from my experience with Margie, like, we had met, we talked about meeting up in Virginia like months ago. And then Kevin was like, hey, I'm going to go have lunch with Margie. You coming? I was like, yeah, let's go. and, and we had a great time. And that's the beautiful thing about our profession, right? We can really connect and things of that sorts. And how you keep your algorithm up to the speed the way you want. So as we're getting near to the end of our hour, we definitely want to have some time to engage in breakout rooms and things of that sorts for those who can. But I want to ask you another question, Margie. Talking more about or talking about leadership. What are those leadership positions that you have, and how are you leading those positions? What is some of that advice you would give to a lot of these PTA students who are leaders or will be leaders from your experience?
Well, I don't have any official titles. Like, I am not an APTA leader member or an exec member for Virginia Physical Therapy Association. I'm heavily involved. I'm okay with kind of being like the background person to make things move. I don't need to be in the forefront. Sometimes I have a little self-doubt. I speak very quickly. Some people may not be able to articulate and keep up with that. Um, for me, a leader is somebody that is in the dirt with their team, fighting, and doing the dirty work too. A leader doesn't sit in the back room or the break room and tell you what to do and delegate. No, they are a sense of guidance, a sense of direction, but they're also part of the team. Sometimes the team's a little lost, and we just need one person to speak up. So I'm very thankful that APTA trusts me to invite me out to things like this and Advocacy Day and Centennial and the virtual rally and um, trying to push for when we needed the signatures to send to Medicare about these stupid cuts. Um, I think that my page serves a purpose, and I think that APTA knows that I connect to some people, especially like non-members. Whether you're a member or not, that's none of my business. I really don't care. However, um, maybe look at it instead of saying like, what value does the membership hold for me? Because I get it as a PTA. It's like, well, I don't get a vote. I don't get to do this. I don't get to do that. What's the point of membership? You guys take $200 every year. Um, Maybe come in there and stir the pot. Maybe speak up. Maybe join the caucus. Come out to a meeting or two. Um, you have to show up, if you want your voice heard. And I'm trying to understand that too. I'm not perfect. Like I said, advocacy is when it comes to like legislative advocacy, it's very intimidating to me. However, we have to speak up for our profession, for prospective students. Right now, with at least once a week, somebody asks me, like, do you think PTAs are like going to disappear? No, I truly don't. Because PTs right now, there's no way you can function without PTAs. If anything, you should ask me, would PTAs disappear? Because there are many clinics, you're just evaluating machines. I get to have all the fun. I get to do all the follow-ups. You just discharge them. And there's no right or wrong path. I am going to be the first person that cheer you on if you go into a DPT program and transition or do a bridge program. I'm also going to be the same person to cheer you on if you change your mind and you're like, I want to do nursing. I had a classmate graduated with me, took the board exam with me, worked 3 months. I was like, yeah, that's not for me. Um, and I was like, cool, you're still young, and go find why, because we have that option now, you know. So I think my leadership looks a little different. It's not a cookie cutter. It's not on a business card. I don't have an official title, but I'm okay with that because I feel like I reach out to more people just being me, being a little goofy and outspoken on my social media than maybe any email can get to you guys.
Mm, thank you for sharing that, Margie. That really hit home with me, and sure with others. And thank you for talking about, getting out there and making your voice heard. That's something that I've also tried to learn and trying to get involved, as a Mexican American male, within the PT community, and also the Spanish speaking community, and just try and do that representation. But it takes boots on the ground. So, especially for all those listening, there's so much involvement. I'm now doing my own little plug, just because those opportunities exist within states. And I know Lisa typed in that, within
Mm-hmm.
the House of Delegates and so forth, and getting the vote was because the PTA caucus was there, support, and what we have on national level for students as well as for professionals. Please know that your voice is appreciated and wanted. Um, and like Patrick mentioned earlier, the Student Assembly Board of Directors, a majority I've seen has always been PT students. We really need that representation, from those PTA students. So please feel free to always message me, Teo, or Patrick about student involvement. Um, Before we go into breakout rooms, Margie, I wanted to give you one more question, some quick fire, something that I think would be good for you to tell us, um, in a short time. But what, from your experiences that you've had up to this point with opening up your page and the reasons of why behind that, your journey to finding your PTA career, um, and your journey to being the leader who you are now, what advice would you give to a student, coming out of school, or a student going into school, to be a PTA or PT?
Um, I would say for those who are maybe having doubts if they made the right decision, whether you're looking into the program, you're into the program, you're a graduate, PT's not going anywhere as long as people are moving. They're going to get hurt eventually. They're going to need us. Um, and also control what you can control. I don't have a magic 8 ball. I damn sure wouldn't be waking up every day going to work if I did. I don't know the future of the profession. However, I do know that we are very valuable and we're not going anywhere. Um, Also, ask questions. You're not supposed to know everything. Even as a graduate, like, even I've talked to clinicians 5, 10 years down the line, they don't know everything. These doctors, have you seen these scripts? They really don't know anything. Okay, so ask questions. I think imposter syndrome is very big for new grads, and we got to break that stigma. Network, and even if you're an introvert, maybe Zoom is your thing. I hate Zoom. I am zoomed out. I really like going to happy hours when VPTA hosts it. I really want to go to a continuing ed class. I don't want to learn about it on Zoom. Things like that. And even during your rotations, treat it like a big interview. You never know who's watching. The PTA world is very small. Um, like very small. You never know who's watching, and you never know if there is a networking or a job opportunity. Um, just be mindful of that. You just never know who's in the room. And always be a lifelong learner. Don't think that you know everything. What I love about our field, PT or PTA, if you get bored in your setting, go to another setting. You don't have to go back to school for that. Maybe take a con ed class or two. But, I went from outpatient and I was a tech in outpatient, did 2 rotations in outpatient. I was outpatient for life, team outpatient or bus. I'm in home health right now. And it's going to take a lot. And when I say a lot, I mean money. A lot of money to get me out of home health. I really like what I do. I think you have to at least like what you do to be in this field, because we're not in the field to make 6 figures. Yeah, you California people, sure. But a lot of us, we're not going to see that big paycheck. We have to do it because we love the profession. We like making a difference. We like helping people. That's what our profession is about. You have to have a little bit of empathy to be in this field. And if you don't, this is probably not for you, and that is okay. I think it's very important to like, at least, I love what I do, but at least like what you do, because that's going to be what gets you out of bed every morning. I'm a morning person, but everybody, that when that alarm clock rings, it's the moan and groan, it's the snooze button. But when you like what you do or love what you do, I think Mark Twain said it best: you never work a day in your life. So find something. If it's not outpatient, there's so many other settings. And if it's not PT, there's so many other fields outside of healthcare too. And that's okay, but find something that you're passionate about, because you have to do this for a while. I'm already 3 years in, and I'm already thinking, like, what's after patient care? I truly believe that I can't work in patient care specifically until I retire, which is probably going to be 70 by the time we all retire now. You need to think of not necessarily an exit strategy, but like, what else can you do in the field that's not patient care? I really want to go back and teach, probably like lab, or do be help with clinic rotation setups. I'm not really a lecture person. That's what I really want to do, because I miss having students. I was a CI 3 times, and I don't have that opportunity in home health right now. And I miss that. I miss when the students have their light bulb moment. I miss when they're like, "Oh my God, I felt that joint move." I miss seeing that spark, because I wasn't the smartest student, right? And it took a lot. My study buddies had to re-explain and explain and re-explain it to me many times to understand a lot of concepts. And I just want to be that one person that maybe, like, you don't get it, but maybe we can learn it in a different way. Or let me give you a different analogy. And I think I'm really good at that, and I enjoy doing that. And we need more PTAs to be CIs. So please consider that.
No, thank you, Margie, for sharing those thoughts, that information, and the wealth of wisdom and expertise that you have. We definitely appreciate that, and for coming on this evening and giving us your time. Now, to all the students on the call, what we want to do now is go into breakout rooms, have an opportunity for you guys to meet up. I know now, having national conferences, we have those right after hours, those side conversations. So this is our way of imitating that in this Zoom world that a pandemic has thrust us in. So if you would like to stay on the call, please feel free to do so, and we'll be put into breakout rooms here shortly. And thank you again, Margie, for chatting with us. And remember to follow Margie if you haven't, on IG, not just the PTA.
Thank you.